What can we do to be healthy nowadays? If we're concerned about our brain health, I saw a neurologist and he said if you want to do anything good with your brain, start with your heart, like exercise and stuff like that. That a lot of brain problems are really heart problems.
Exercise 100%, like intense exercise increases BDNF, which is like miracle grow for your brain and is very protective. And absolutely, like, sure, but I think if you had to choose one thing, it would be the exercise more than anything else. Intense exercise and almost really kind of as much as you can. It makes me feel better. But I really believe that that's like the one activity that's going to have the biggest impact on my health span and delaying things like dementia.
How do you know when you're having an intense exercise or if you're just out of shape? Like, at
Yeah,
a certain point you kind of plateau and it's like, oh, it's easy.
it's all relative. So it's all heart
Mm,
rate based. So for me, it's
okay.
zones and it's heart rate based. And I'm always measuring my heart rate when I'm doing workouts. I do you have kind of your base, which is zone two, where you want to do most of it. That's kind of like 60 to 70%, just kind of use really rough numbers of your maximum heart rate, which would be 220 minus your age, or you can actually do a test and see. And then I want to spend certain amounts of times in zone three and four, and like a tiny amount in zone five. And now for me, if I'm in pretty good shape, and then you got someone else who's not in good shape, well, they're not going to have to actually do as much to get their heart rate up. So it really is individualized and personalized and relative as to what is intense exercise. It's more about your heart rate zone compared to your maximum.
Mhm. So if you're a fit person, and my objective is to be fit as well, but what do you do during the different zones to hit it then?
Sure. So zone two is a zone where you should be able to have a conversation. Like right now, if I was in zone two, you could tell you don't want to have a conversation, but you can, and people would be able to understand it just fine. Once you get to zone three, you're not having a conversation anymore. So this is when if someone doesn't want to follow kind of their heart rate zones, just want to measure it with an Apple Watch or a chest strap or something like that. This is how I kind of talk about it. That zone two where you can talk, you could do it all day, but you don't want to. So how I do it is a couple different ways. For me, the best two ways is I row, and I love to watch like educational documentaries and stuff. And so I can row, be on a row machine for an hour and in zone two, and I got a good workout. Where I do a lot of rucking. So I will fill a backpack with about 70 pounds. I mean, it's just different for different people and how big you are. But I put weight in that. And what I love about that is you're getting the cardiovascular benefit, similar to maybe like if you were going for a slow run, but you're walking. It's not as hard on your joints and my back is now that I'm an old man. I got to think about things like that. And you get a little bit of a strength workout. So I'm into getting zone two, but doing a strength workout because I'm carrying a lot of weight on my back as well.